asked a question that I'm sure everybody in this room has been asked at least a half a dozen times. And the question was, what is the characteristic that is most important to success as a leader? And it was interesting that although I had been asked this question before, this particular time, I had a very visual and very literal image of leadership in my mind. You know, standing first in a really long line of people. And how standing in that lead position really takes a lot of courage. You don't entirely know what's around the corner. You don't always know where you're heading. It reminds me of the Dilbert cartoon that the president shared with us yesterday about change. Change is good, you go first. And I thought a lot about the leadership that the American Nurses Association provides to nurses in this nation and what courage it takes, particularly in this time of dramatic change when none of us entirely know what is facing us around the corner. Eric Hoffer, a philosopher, advises us that in times of dramatic change, it is learners that inherit the earth. And I thought about what a learning organization we have become. The way we have tried new things, the way we have changed, the way we have expressed our courage. And to really help you understand that, I want to take us all back to 15 years ago when Robert Putnam published his book, Bowling Alone. This was a book where he used bowling leagues as an analogy to describe the disintegration of us organizing and aggregating together to make changes, or even socially, like in bowling leagues. And he talked about the decline of associations in the United States. And he used the American Nurses Association as an exemplar. You know, this was not a book that you wanted to have your name dropped. But our picture looks very different than it did 15 years ago. Our picture of membership tells a very different story than what Robert Putnam talked about. In the last 3 years, we have a net increase in membership of 25,000 nurses. That's a 27% increase over the last 3 years. That is something to celebrate. And what I will tell you is that every year we do a survey of our members to understand their satisfaction. And one of the most important pieces of data in that survey is something called the Net Promoter Score. Now, if you study the Net Promoter Score, businesses will tell you it is the best indicator of your future business growth. And our Net Promoter Score today is twice as high as it was 3 years ago. It increased by another 4 points just in the last year, which indicates future growth. Here's another fascinating statistic. Because it's our net membership growth that increased by 27%, that means we acquired a lot more new members who have joined our ranks. And today, about half of ANA members have only been members in our association for 3 years. They didn't even know the association that Robert Putnam talked about. They know this association and who we are today. And how did we get there? What have we learned? Well, there's a couple of things that we've learned. One is we've gotten really good about inviting people to join us as members. We've applied learning analytics to how we invite people to join us. And so each time we have a membership recruitment campaign, we study and we test, and then we hardwire what works. We also have engaged in partnership between the state and national associations in a much more sophisticated way, in a much more synergistic way than we ever have in the past. In essence, what we're doing is co-branding, so that the work that we do at the state level and the work that we do at the national level builds one upon each other, so that our nurses see more of our work and how it all fits together. We also have, as we've been acquiring new members, really improved the process of collecting data about who they are as individuals, so that we utilize member profile information to better target who is coming to us as a new member. And we'll be doing campaigns around those of us who've been around a long time to improve the data that we have about who we are as members. And one of the best examples of that is actually the way that we have targeted attracting and engaging new registered nurses, one of the President's top 5 initiatives, as you heard her talk about yesterday. We started this with our Welcome to the Profession Toolkit. The Welcome to the Profession Toolkit is something that we did in partnership with the National Student Nurses Association to get students to engage with us in this virtual toolkit, so that we can easily move them from their Student Nurses Association into their professional association once they are registered nurses. And because we now have that group who are newly graduated registered nurses in one aggregated place, we've been able to build on and really target what that group of students need. So we've created a new grad community where they can dialogue with each other about the issues that they are facing. And we support that with things like virtual town halls about how to write a cover letter, how to write your resume, how to interview. We also are in the process of creating mentoring programs, and we already have 160 ANA members who have stood up and volunteered to serve in guiding their new graduate colleagues. And so you'll hear more about that program as we roll it out even further over the course of the next year. Now, it's really interesting that we've not just been trying to acquire new members, but we want to make sure that we service those members very well. And one of the conversations that we've all had for a very long time is that one of the responsibilities of us as the American Nurses Association is our core foundational documents for the profession. Everything from the Code of Ethics to the Social Policy Statement to our scopes and standards. But all too often, people only look at those documents when they are a student, and they don't really understand how relevant they are to their daily practice and how to utilize them in their daily practice. And so we tested last year this concept of focusing on a particular theme for the whole year. So last year was our year of ethics. And I have to tell you that the numbers alone tell the story. We had over 4,000 nurses participate in developing the Code of Ethics. We had over 14,000 registered nurses participate in some education around ethics and using the Code of Ethics in their practice. And at the end of the year, when we surveyed those nurses, 3/4 of them told us that they actually used what they learned to apply in their practice setting. And out of all the numbers, perhaps the number that is most important is the number 1. The one Navy nurse that this association stood by, who because of our support had his full military duty privileges reinstated because he stood by our nursing code of ethics. That's the power of this association. And what we've done is we've taken the learning from last year's year of ethics, and this year we are applying it to the culture of safety. Now, we knew at the start of the year that the culture of safety was very important work, and just last month, this was the kind of data that was being reported, that medical errors now are the 3rd leading cause of death in the United States. And although some may question the methodology of this study, we all know that we can do a much better job in creating a culture of safety. What I've seen happen this year and the way we've built upon our learning is that we've built in what we've learned about the use of social media to reinforce all of the things that we've done as we plan a year-long activity. So for example, we planned tweeting around Nurses Week around the culture of safety. And I will say that one of my favorite tweets of the year so far was a tweet by HHS Secretary Burwell and Acting Deputy Secretary Mary Wakefield using our hashtag #SafeNursesRock. That's amplifying our message about the importance of nurses in the culture of safety. Our organizational affiliate colleagues in the Oncology Nursing Society have paired up each month the activities that the American Nurses Association is doing around the culture of safety with clinical specific things for oncology nurses in the topics that we are utilizing. And we talked about this work earlier this week during the organizational affiliate meeting, so that once again, it is a way for all of us to work together and amplify our messages. You also heard the president talk about the need to really partner with and focus on our speaking in partnership and directly with consumers. And our keynote speaker yesterday talked about patient engagement. And one of our newest publications does exactly that. We have nurses now talking directly to patients about being engaged in their own practice when they go to a hospital to make sure that they are getting safe clinical care. Now, I cannot talk about using social media and last year without, of course, mentioning the Nurses Share Your Stethoscopes outrage and outpouring that occurred. And you all know the story as well as I do. Of course, we saw the commentators on The View make disparaging remarks about Miss Colorado because she was wearing her doctor's stethoscope. What you may not know is the backstory, is that it actually was one of our members from the Rhode Island Nurses Association, Jocelyn Liaska, who called the Department of Communications at the American Nurses Association and let us know what was going on. And that's when we began really amplifying the tweeting about this. And what I think really happened here was not just a call to action and not just an outrage, but we did exactly what the president advised us about yesterday. When encountered with people who do not understand nursing, calmly and patiently explain to them what nursing is today. And through hundreds and thousands of pictures, we demonstrated the diversity of our practice, the impact of our outcomes, and what we look like with our nurses' stethoscopes around our necks. That is the power of communicating. Now, we talk a lot about numbers, and we talk about the number of tweets and the number of Facebook pages and postings and all of that, but in this particular case, here are the numbers that matter to me. 17 companies pulled their advertisements from The View. Yeah. And our ANA president actually had a conversation because she got a phone call from the president of ABC, giving her an opportunity to patiently explain what nursing is today. And speaking about the opportunity to patiently explain what nursing is really today, we have another opportunity with the handbook that the Department of Veterans Affairs has posted, suggesting that our veterans deserve and have the right to the full practice authority of our advanced practice registered nurses. Now, I am going to be perfectly honest here. I personally am having a hard time being patient around this one. But I will persevere, and we are being very systematic. We are writing letters to the editor in USA Today. The president is coupling with some retired military as she is publishing some materials in Huffington Post. And you all know that we are creating an outpouring of communication about the value and the quality of care and the contribution that our advanced practice registered nurses are giving to veterans and other people all across the country. If you, by chance, have not yet written your letter, please do go to the PAC booth before you leave today, and they will help you to make sure that you are able to get a response. Now, we're not only focused on advancing full practice authority for APRNs, very important work, but we recognized also that there was an opportunity for us to make sure that every registered nurse is functioning to their full level of education and training. And so the board chartered a professional issues panel to look at barriers to RN scope of practice. And I am really pleased to share with you that that group has completed their work. They basically created a model or a methodology to look at what were the barriers, what were the desired states, and what strategies and tools can be utilized to fulfill that gap. They will be publishing the results in the September issue of our online Journal of Issues in Nursing. And I'll remind you all that you as ANA members get first access to that information before it becomes open access to all registered nurses. So that is something to look for in September. Now, I don't want you to think that we're only responsive to other people and that we can't stay the course, because certainly when you look at the courage that we had in coming out early in support of the Affordable Care Act, we have coupled that by our unstaunching support as each time this law was challenged. And I don't feel like I need to tell you the statistics about what this law is producing. We know that more Americans than ever before are covered by health insurance. And we are seeing the improvements in the quality of care that we are delivering in this country. Just earlier this week, I was looking over a presentation that I happened to give right after the Affordable Care Act was passed. And one of the things that I said in that presentation was, while everybody was talking about insurance coverage, that we understood that that was not going to be the big impact of this law. The big impact of this law was going to be on improving the quality of outcomes. And we've seen the shift from paying for activity to value-based purchasing. And what we need to understand in that shift is exactly how to position and how to navigate to make sure that nursing is well positioned as we are going through this transformation in healthcare. And so in order to survive in a value-based world, a value-based payment world, we need to make sure that there are quality measures embedded in public reporting that are utilized for payment mechanisms that reflect our nursing practice. And in order to have those quality measures in public reporting, we need to make sure that in our electronic health records and other databases, we are collecting and aggregating information about nursing practice so that we understand what is best practice and how do we contribute to even better improving the quality of healthcare for our patients. So as we've shifted from being the ones collecting the data to the ones utilizing the data, I think one of the best examples of that is the toolkit that we put out related to CAUTIs. And what happened was we saw that hospital-acquired conditions were actually being reduced in almost every category except for catheter-associated urinary tract infections. And so we went to the available data that has been captured in a standardized way because of the work of the American Nurses Association and looked for best practices. And we aggregated all of that information in one toolkit. And we are now beginning to see reductions in urinary tract infections, not only because of our work, but because our good work was recognized and the CDC and the National Patient Safety Foundation helped to spread our toolkit to make sure that it got out there. And that is exactly a model of what I see the future of the American Nurses Association. Let's do the work and let's have everybody else spread the good work that we are doing. Now, you can't talk about quality outcomes without talking about staffing. As I often say in meetings, withholding nursing staffing is the same thing as withholding a life-saving medication. Yeah. The sad part, though, is we know that, and it's not happening. And so one of the things that we did this year is that we partnered with Avalier to help us write a white paper to aggregate all of the research that we already know, but to language that in a paper that we could utilize that is in the language of policymakers and CEOs and CFOs, so that we now have a paper that you can find on our website about optimizing nurse staffing for the purpose of improving patient outcomes that speaks in the language of others so that they begin to understand, as we patiently explain once again, the impact that nurse staffing has on patient outcomes. We're continuing to work with Avalier, and so you'll continue to see additional tools that will help us to do this work. We also understand that improving quality outcomes sometimes is the errors that we're seeing are not just because people are making mistakes. Sometimes they are errors of omission. And nobody was talking about errors of omission that occur often because we don't have the right staffing or because we don't have the right work environments. And so through the work of Beatrice Kalish, who was an IOM, National Academy of Science Fellow, sponsored by the American Nurses Association, the American Academy of Nursing, and the American Nurses Foundation, we were able to publish a book on errors of omission. So you can see the space that we're operating in here. The last thing that I want to share is about this point of data makes a difference, which is the title of one of our publications. The board recognized in their last strategic plan that one of the things we need to do is educate ourselves as registered nurses on how to use these big data, to identify the trends and to make improvements. And so we have the one publication, but you're going to see increasing education and materials to support us as we really understand how to live in this big data world. Now, all of this work, of course, is helping us to achieve the triple aim of better health, better care, and lower cost. But we all know that we cannot get there without also supporting the healthcare provider. And so we've continued the work that we need to do to make sure that we are working in the environments and we are supported to be our best in order to deliver the healthcare that we want to deliver. So almost a year ago now, we updated the position paper around incivility, bullying, and workplace violence. And we updated all of the materials associated with that so that we had modern contemporary materials with the best information. We also have taken a renewed look at safe patient handling and mobility and have a serious conversation about how do we take those standards and make sure that they land in the lap of the registered nurse. So we've done an environmental scan to know how those tools are being used. And one of the things that we decided to do was to create a tool that would allow every organization to do their own assessment about how they are doing in comparison to the standards. And as we began developing that, we recognized that Atlas Lift Technologies was far ahead of us in doing that work. So we have partnered with them and now have ready to come out a tool for organizations to be able to do that assessment. It is not yet on the website, but I will tell you that if you stop by the ANA booth, you will see an example of what I am talking about, and you will be able to give them your contact information so that you will be the first to get the information as soon as it is available. You will get a briefing later on today about Healthy Nurse and Healthy Nation, but we all know that one of the ways that we can improve the health of this nation is by improving our own health. Because as soon as we improve the health of 3.6 million people in this country, we will improve the health and we will serve as the role models for others in how to improve their health. Now, all of this, of course, requires us stepping into leadership, and you've heard a lot about this. This year alone, ANA assisted 40 nurses in getting national appointments. You've heard us talk a lot about the work that we're doing in partnership with other nursing associations around the Nurses on Boards Coalition. And we're continuing to make sure that we are preparing nurses to serve in leadership positions. We will literally double this year the number of programs that we have in our ANA Leadership Institute. And we are continuing to publish more books to support nurses in their leadership journey. What I want to share with you is the recognition that we are getting from all of this work from our colleagues in the association world, in the PR world, and in the communication world. Everything we are doing, from our use of social media to the publications that we are putting out, to the way that we are recruiting nurses into our association, to the way that we are describing the work that we do, is receiving accolades. We talked a bit about the branding. I will tell you that your brand is not just your logo. Your brand is what people say about you. In a very rapidly and very changing world where nurses need us, we have changed our brand. We are no longer bowling alone. We are thought of very differently. And that, I will tell you, in everything from ethics to membership, from safety to quality, from leadership to healthcare transformation, has to do with the way that we are learning, the way that we are leading, and your courage in leading the way. Thank you for your leadership.